Government ready for this undertaking of a vaccine mandate? Do we have enough doses of the vaccine to meet the great surge in demand that will definitely follow in the coming days? Dr. Willis Akhwale is the chairperson of the COVID-19 Vaccine Task Force. He now joins us this evening to answer these questions. Good evening, Dr. It's good to have you in studio.
Yeah, good evening. It's also a pleasure to be back at KTN.
Yes. Now, by continental standards, the number of Kenyans vaccinated so far, about 6.4 million, is impressive and credit to you and your team. But now the question is, why then are we looking to turn an exercise which has so far been voluntary into one that looks like it's going to get coercive by the issuance of a COVID vaccine mandate by the government?
No, thank you for that question, and I really want to clarify that and refer people back to the speech by the Cabinet Secretary, Honorable Mutahi Kagwe, on that. There is nothing mandatory about vaccination. What the Cabinet Secretary did was to lay out clear measures that enhance public health measures that enhance the gains we've made in the war against COVID. These are timely public measures for two reasons. One is that we are seeing upsurges. And if you go to his speech, he gave the numbers in Europe. 2 million cases reported in a week in Europe. Then we are going to festive season. During this festive season, there'll be a lot of travel. People will be coming to Kenya, tourists. Kenyans will be traveling. And during this time, we are bound, therefore, to get a situation where you get a lot of transmission. And then he also came from the basis that this disease spreads where people crowd. Now, you encourage crowding, you are then creating a situation where it will spread. So these are actually public health measures. Otherwise, vaccination remains voluntary.
But the Cabinet Secretary said that without proof of vaccination, Kenyans will not be able to access some services. But according to the WHO, Africa lags in COVID-19 vaccination rates due to global inequities in vaccine supplies, not necessarily because Africans do not want to be vaccinated. The issue, therefore, is about supply and demand, the availability of the vaccine. Is this statement by the WHO true?
It is true, but I also want to qualify. It's important to go back to the Cabinet Secretary's speech. What he said, for example, is that there will be no in-person government service. That does not mean you are denied the service. There are so many other ways you can get a service. You can make a call and still be served. Nowadays, there's a lot of digital processes. You can do that. The last point where you may need to pick something, you can send somebody to pick that document for you. So the services will continue. But we don't want a situation where the service is turning out to be the engine of the waves that may come as we go forward. Now, in terms of acceptance, you know, when you do a survey across Africa, there are usually variations. Even in this country, I want to make it clear that we've been following the patterns of uptake of vaccines, and there's such a wide variation. But we've realized when you tighten measures so that there's proof that somebody is vaccinated, the uptake goes up.
But either way, it is 29 days to that December 21 deadline, and we're talking about an adult population that ranges between 20 million to 30 million or so. 30 million or so. Now, the question is, do you have the capacity, both in terms of the availability, the number of doses of the vaccine available right now in Kenya, and the capacity to actually handle this number in a matter of 29 days?
So let me start by saying there were the initial challenges when we didn't have enough vaccines. We deployed them to few facilities. We had less workforce to do this. That has dramatically changed. As we speak now, we have 10.7 million doses. We have just utilized 6.4. So you see we have another 4 million doses. Between now and just before Christmas, we are getting 8 million doses. In fact, tomorrow we have 1 million doses of J&J coming. We have another 1.6 the following week. We have 3.7 million doses of Pfizer coming. So we have, if you add the 8 plus the 4, we have almost 12 million doses to be utilized before Christmas. Now, these 12 million doses now are being distributed widely, and we even plan a campaign. If you look at the data today, and that will come tomorrow, we are now vaccinating 100,000 per day. So with 100,000 vaccination per day in 30 days is 3 million. To add to already 6 million, we will be reaching our target. But it doesn't end there. Remember, we are getting more vaccines in January. In fact, the supply, the outlay going forward is massive. Now the vaccines are available globally. So it should be people presenting. I will only be worried if people tell me by 20th of December, 12 million vaccinations have been used. Now we have nothing.
But we're talking about some vaccines that require double doses. The first dose, then a second one. I'm informed there's one, the Johnson & Johnson, that is just one dose. But for you to have that certificate, the proof that you have been fully vaccinated, you have to have taken both doses. Within the next 29 days, it is not possible for anyone to get both doses because there needs to be at least a minimum of 6 weeks in between the doses. Then how will we be able to achieve this so that someone can actually say, I have proof of vaccination?
Now, let me also point something that the measures the Cabinet Secretary proclaimed touch on various sectors of government. Teams, so you see there's transport, there's hospitality, there's the Ministry of Health, there will be Ministry of Sports. So within government, these teams are going to meet to plan on how to best effect these measures. So the details will come. The ideal will be full vaccination, but if this team decides that even one may still be accepted for the time being, is better, because partial vaccination is better than nothing.
So we should expect more communication on
you should.
On how this vaccine mandate will be carried out,
and
absolutely. The possibility of one getting proof of the first vaccine.
Okay, but let me mention that once you've got even your first dose, the change of system already indicates your certificate is actually there, but it will say you have one, so you can use that if that will be permissible.
Although the pronouncement by the CS said fully vaccinated.
That's the ideal.
Yes. Okay. And therefore the question is the number of doses available, because now you're planning a 10-day vaccination drive starting this Friday, and with that you expect to vaccinate about 10 million people. Do you take into account the need for the double doses when you say 10 million?
No, yeah, it's important for us to really state our milestone of the vaccination program. By end of this year, if you look at our deployment plan, our target was 10 million vaccinations, not 10 million people. 10 million vaccinations. So some will be 1-2 doses, but we had anticipated Johnson & Johnson, which is single dose, will be the main. Although there was a delay in those doses coming, now they are coming, and that's why you see our rate of full vaccination really now moving much, much faster. So for us, it will be to first reach 10 million vaccination, but the doses we actually have, we can even go beyond that. It is now incumbent upon people to actually show up, because as I've told you, we'll have 18 million doses. So we could, with 18 million doses, actually even vaccinate 20 million, because there are usually some gains when you are doing vaccination. Some of the vials may allow you to vaccinate 1 or 2 more people. So we actually have vaccinations to vaccinate a lot of Kenyans. But it is so important that the people also volunteer themselves. We've been doing communication. We are not tiring. We are going to continue awareness campaigns. It will be part of the 10 days. We are really going to go down to the villages. But immediately after that, it is so important then that people take this life-saving jab.
And of course, there's that issue of vaccine hesitancy, and quite a number of people have been reluctant to go for the jab, probably due to matters of faith. And is there anything in particular you're doing as a task force to actually counter this?
Yes, you know, we've been in very constant touch with the Interfaith Council. The Interfaith Council, we've given them briefs. We've included them in our communication campaign. We want to do that even a lot more, especially now at the county level. We are using places of worship like churches, like mosques, as also points of vaccination. But we also see the real need to address some of the socio-cultural issues that we seem to be hearing from some of the counties. There's a lot of variation. We have a not very impressive uptake in Western Kenya. All the counties of former Nyanza and Western. And when you really interrogate, there's something touched on fertility that they strongly believe that the vaccine will cause. And nothing is further from the truth. There have been scientific studies that have really shown that they do not affect even the sperm count.
Well, okay, and now kindly delve more into what to expect in this 10-day vaccination drive, because so far we've seen, and it has been a very voluntary system, people turning up for the vaccination. What difference are we going to see during that 10-day period from what we've been seeing so far?
A number of things. First and foremost, you'll see us utilizing more vaccination posts. A very close collaboration with the counties. The counties must really push this. In fact, you'll see counties that have embraced this are performing much better. So counties will be on the forefront. It will be a partnership. We have a lot of our development partners who will be joining in the campaign. It will be very similar to what you hear measles when you see us doing the campaign. The only thing is important to note that this is also, you are using injections, unlike polio, which you are just putting in the mouth. And secondly, we are targeting the adult population. So you will see more constant outreaches. There will be a lot of outreaches trying to reach to the elderly, whom we have not vaccinated as much as we want. You will hear more on messaging during those campaigns. You will see us going to even places closer to where people are in the markets. You will see vaccination
units.
Yes. Yes. You will see them at the markets. You will see them at the bus stages, termini. And really, it will be voluntary. That remains a very core principle. As I've said, the measures, when I ask you for a certificate, it is also to give confidence to everybody else. Because like we are in government and I'm working in an office and every day, I'm vaccinated. The science has shown people unvaccinated transmit the virus. They shed it. They throw it in the air. So if I'm in that office and every single day people coming to see me are unvaccinated, I'm at a risk. The government employees are at a risk. So that's why we want many people. And prove that you are vaccinated gives you that confidence.
Yes. But probably the CS therefore needs to make a correction on his statement from fully vaccinated to vaccinated, so that even if you've gotten the first jab, then you will not be required to show proof that you're fully vaccinated. Because
as I've said,
the demand for transportation is going to go up as we head towards the holiday season. People are expecting to travel to upcountry and to other areas for their holidays. Socializing in places like restaurants and such, and that is where the statement really hit hard, that you will be required to show that you've been fully vaccinated in order for you to enjoy these services, including transport, which is basic. Don't you think that then the communication should be made much clearer?
As I've said, there will be a committee that delves into this. If they make that decision, that if they advise on that. But as I said, the ideal will be full vaccination.
Okay. Let's now touch on to something new. And from Tuesday, which is today, people over the age of 15 are said now to be able to get the Pfizer vaccine, COVID-19 vaccine. And now this is in Kenya, within our territory. Most of these, this age group are found in schools. Is there a plan to actually take the vaccine to schools? And will there be a requirement for parental consent before some of these minors get the vaccine?
Yes. Let me start with the first one. There will be parental consent. We are insisting on verbal consent for the teenagers to get vaccinated, either by the parent or the guardian. So that is, we've put that measure in place. And any other emerging issues will be discussed and advised. But that's where we are starting. Now, let me say that we are starting with them. There's regulatory approval by the pharmacy board. The vaccine is also being used even in other countries for this age group. And part of the reason this is important is first and foremost, within this age group, you also have people with underlying medical conditions, and they have been really looking forward to this. But secondly, is the young people who are the main carriers. They are the ones who are spreading this. So we need to tackle that transmission at that age group. currently, however, the biggest burden is in the elderly. So the doses that we currently have, our main focus is actually the elderly. However, for the young people willing to be vaccinated voluntarily, then we've opened this opportunity for them. But until we really see we've covered those at risk, because we've seen the upsurges and the data we are using, until we really cover those ones, so that we fully open it to the young, that's when we'll fully open it to the teenagers. So the issue of going to schools may not be immediate now, but it's a plan as we get more doses and move ahead.
What about during the 10-day enhanced campaign? If at all any 15-year-old, 16-year-old, 17-year-old feels that they need this vaccine, do they need to be accompanied by a parent before they can get a jab?
At this point, we want that parental consent. At this point, yes.
Okay. So no teenager can just walk to a vaccination place and get the vaccine. Now, we've received reports from what is happening in Europe, and we've seen a surge. And European countries, some of them have the highest vaccination rates. What does it mean, therefore, that despite high vaccination rates, there could still be danger lurking later on, even for us?
Yeah, so let me say the COVID-19 virus and disease as such, there are still a lot of unknowns, but we continue learning many things. One of them is that the disease seems to be taking a seasonal kind of occurrence. There seems to be seasons. You see in Europe now is the onset of the winter, and these upsurges are coming. Here in Kenya, we've also seen March is when we see them. We see them in July and a bit of October, then it starts going. So there's some seasonality that we really need to map. That's number one. Number two, we have seen the issue of variants, which can also change the disease pattern. A variant may be different. This year we heard of the Delta variant. Even as upsurges come, I think one has to be on the alert. Is it a totally new variant that we may be dealing with? Then finally, the thing we learn about from what is happening in Europe, remember some countries started relaxing the rules and regulations a little bit too early, if you ask me. People started going to stadium, people removed the mask, dropping the guard, as we are saying, a little bit too early. Might that be fueling what we are saying in Europe? Is a possibility that we need to really look at.
Is that the case in Kenya? Because once President Uhuru Kenyatta lifted the curfew on Mashujaa Day, everything went back to normal, because we're seeing crowds, we're seeing campaigns going on. Don't you think that therefore we run a risk as a country? And
absolutely, the reason, the measures the minister said. In fact, for us, what we are seeing is that with the festivity season, with what is happening in, and that dropping of the guard, because currently the number of cases are so low, so Kenyans trying to say this thing is gone. That poses us a very big risk. And that's why we are putting now these measures. Because if by January we get a huge epidemic, then the question will be, why didn't the government act? So that issue. So this time we are acting. And that's why we need the support of the measures that the ministry has set in place. Now, the other thing that we really need to take into consideration is that next year, already politicians are out there. They are with big crowds. We learned from India. The epidemic in India, if you follow closely, was a lot of political activity as well. So for us to prepare for really that crowding that will be there, because the culture of Kenyan politics is crowds, then we need people vaccinated. We have talked to counties, and we are hoping to engage political leadership a lot, so that in those crowds, now that the young people can be vaccinated, as they attend those rallies, they will have to be encouraged to also get vaccinated.
Okay, and finally, Daktari, taking you back to the issue of availability of the vaccines and the number of doses. Initially, we relied a lot on donations of vaccines from Western countries and developed economies. Are we still relying on donations, or have we started procuring the vaccines directly?
Let me say and put the record straight. As early as May this year, Kenya had funds to procure vaccines, but the vaccines were not just available because the rich countries had overbooked the supply chain. In fact, I remember the very first order we tried to put for Pfizer, we were told February 2022. So the African Union mechanism, gov't, is the one that gave us the earliest opportunity for August to deliver. And Kenya has booked 13 million doses of Johnson & Johnson.
Which are already available, or we're hoping they will be made available?
Actually, they are already available. They have, initially we got 300,000. There were challenges. Then we got 5. We've got almost 1 million already delivered. And next week, we have 1.6 million being delivered, paid by the government of Kenya. So we are depending on that. And within COVAX, we have two mechanisms. You have what you call the donations by the rich countries, because they had reached their targets. But we also have what you call allocation. Kenya is a member of COVAX. So they are allocated vaccine doses for us. What I can assure Kenyans is that the target for next year, if we look at the supply chain, both what is procured, what we'll get as allocation from COVAX, and coming in as donation, is enough to meet our target, 30 million. That 30 million were 27 million adults and regulatory approval for the teenagers.
Okay. Well, Dr. Willis Akhwale, Chair, Minister of Health, COVID-19 Vaccine Task Force, thank you so much for agreeing to this interview and for informing us more on the requirements of the COVID vaccine and the 10-day campaign that starts this Friday, hoping to vaccinate at least 10 million Kenyans by Christmas Day. Well, that has been Newsline. We now leave you with a continuation of the interview that Katie and Sophia Wanuna had with former Nairobi Governor Mike Sonko earlier today. On behalf of the entire team behind Newsline, my name is Fred Ndimuli. Good night.